Hello, my name is Priscilla Tran, and the domain I chose to do my patient's perspective on was linguistic competence. The patient story that I'm about to share is actually about my uncle who is 76 and speaks limited English. He has a history of hypertension, diabetes, and hyperlipidemia. So, the story that I'm going to share is about him going to an urgent care in Huntington Beach. He came into the urgent care due to having a temperature of 102, body aches, nausea, vomiting, and generalized fatigue. He entered the facility not knowing where to go or check in because it was his first time there. He therefore went up to the receptionists and asked for help, telling them that he felt sick. The receptionist pointed to the check-in iPad, which was about a couple feet away, and told him to answer that and check in and to have a seat afterwards. He went over to the iPad and stood there for a few minutes trying to look over the questions. Due to not being able to read that much English, he did not know how to answer the questions and therefore went back to the receptionist and asked for help again. She said that she was very sorry but was unable to help him at that time because she was helping other patients with their issues. He then tried to go back to the iPad to read over the questions again, but was not able to answer anything. Finally, another patient that also spoke Vietnamese was able to come over and help him check in. According to Ngo Metzger et al., linguistic competence is when an organization has the ability to communicate efficiently with individuals with limited English skills, little to no literacy skills, or are disabled. An organization that does have linguistic competence has available resources for patients that are limited in English, disabled, or have little to no literacy skills. Some of these resources include interpreter services, bilingual employees, and licensed translators. Healthy People 2010 defined health literacy as the ability for patients to understand the health information given to them by providers and healthcare professionals. This information allows them to make well-informed decisions about their healthcare. Limited English proficiency is defined as people that do not speak English as their primary language and have limited English speaking skills or writing skills. Individuals that do have low health literacy or limited English skills may often do not know how to properly understand the decisions that they made or are making about their own health, therefore leading to poor health outcomes. Some of these health outcomes are caused by lack of medication compliance, not attending their yearly physical exams, being unable to communicate their problems to their providers, and being unable to understand the physician's treatment plan and recommendations to them. Oftentimes, they do not come back to their yearly physical exams because they are unable to speak with their provider. The domain of linguistic competence is related to the patient's situation because there was a communication barrier between the patient and the urgent care, since the patient did have limited English proficiency and the facility was not linguistically competent. So some of the factors that played a part in this situation, so the urgent care, first of all, lacked linguistic competence. No bilingual staff was available. There were no interpreters or translating services that were offered. The check-in service that was on the iPad was only offered in English and not in Vietnamese, and the receptionist was not able to understand the patient and therefore did not assist him further. The patient was limited in English, was not able to get assistance due to having a heavy accent and poor English speaking skills, was unable to read through the check-in service, which was only offered in English, and was not able to get his point across to the receptionist, which is why, due to his limited English skills. Some of the potential solutions include having the urgent care have interpreting services, either through phone or video chat communication, having bilingual staff that spoke Vietnamese, have check-in services be offered in other languages besides English, including Vietnamese. And last, they could have had more staff available when the urgent care was busy at that time, so that someone was always available to help patients that did need assistance. If these possible solutions were available, the patient would have been able to check in faster and would have been able to see the healthcare provider sooner. Due to the lack of linguistic competence, there was a delay of service due to not being able to check in right away. And here are my references.